Yeah, so it became pretty routine during pregnancy to just check the levels. And I will say I needed to be proactive about it because my OBGYN wouldn't necessarily be staying on top of it, and nor would the neurologist. So it was something that I needed to be proactive about, but was really easy to do so in that I can't remember the exact cadence, but I think it would be at least once a month, maybe a little more frequent at the beginning of pregnancy and at the end of pregnancy, that I would just, mention to the OBGYN, hey, can you write me a script for a blood test this week so I can just make sure the levels are checked? That would happen. She would send it over to the neurologist. The neurologist would get them, message me like, hey, adjust your epilepsy medication this way or that way. And that became pretty easy and routine. It wasn't really anything significant. And again, my neurologist had really prepped me for it in explaining that because of the hormones in pregnancy, your body just might absorb the medication differently. So you might end up taking more. And obviously my concern then had been, but is that going to hurt the baby in any way? And she explained very clearly, no, it's how your body is breaking it down. So even though you might be taking more, your body's not actually getting more. And that became really clear to see in the levels. I think my baseline level where before pregnancy was around an 11 or something. And at some point in the beginning of pregnancy, it dropped to like a 5 or 6. So being able to see that in the blood work, in the science, then kind of like told me, okay, this is logical. I need to take more because it's not there in my blood. So that, again, became just really routine and was easy to track and easy to do. And then we did it again at the end of pregnancy. And again, my neurologist had been really clear, before you leave the hospital after delivery, make sure you're getting your blood checked, and then we'll see what we need to adjust post-pregnancy.